Hi everyone, Dr. Saurabh here. So today's we will see the explanation of 10 questions on the different types of cataract. I'm ready to give the quiz in the same manner like if I were giving the quiz like you have given. So first question is which is not a factor for formation of cataract? Three factors are important, which is option number A, B and D. Calcification is not a factor for cataract formation. Denaturation of proteins, which will lead to in, increase in insoluble proteins, which is albuminoids. Insoluble, which are responsible for transparency crystallines. Insoluble are more, solubles are less. Hydration, the second option, will lead to intumescence, swelling of the cataract, swelling of the lens, while degenerative change in the center of the lens is sclerosis. Calcification is not a factor. Now, if the patient is not able to see in bright sunlight, particularly incoming headlight of driving at night, that symptom is known as glare. That is specific for due to scattering of light in posterior subcapsular cataract. And the various differentials of PSC. That's the last question. Now, all of following are true for senile cataract. Now, by definition, senile cataract by Government of India is more than 50 years of age, unless and until it has been associated with diabetes or other metabolic condition. Now, B option is the answer over here because it is equal incidence in men and women. Cortical is due to intumescence, that is hydration of the lens, followed by coagulation, and nuclear, I told you, is due to sclerosis. So, there is no gender differentiation. Now, cortex is periphery of the lens and center is the nucleus. If the cortex is liquefied, the nucleus sinks to the bottom. That is seen in hypermature Morgagnian cataract. Now, many people might have answered this feculitic, that is glaucoma. Hypermature Morgagnian cataract will lead to feculitic glaucoma. But my question is, which is a cataract? So, answer is C. So, disturbance in the nutrition of lens due to inflammatory condition, degenerative, any intraocular pathology will lead to cataract, which is looking like polychromatic luster, breadcrumb appearance. I hope you can get it now. It's a previous year question, that is complicated cataract. Christmas tree cataract due to myotonic dystrophy. Snowflake cataract is type 1 diabetes mellitus. Sunflower due to chalcosis or Wilson's disease. Now this is a rosette, star-shaped rosette cataract, which is mostly in the posterior region of the lens in blunt trauma. Now this is a congenital cataract, and in this, the question was the child was brought and child was having cataract, which is the uh, uh, which is the management. So here the cataract surgery is not needed because it is the most common shape of congenital cataract, that is blue dot cataract, and it is asymptomatic, does not cause any decreased vision. So cataract surgery is not needed in blue dot cataract. Now many people must have done this question wrong. Type 1 diabetes mellitus has snowflake. Type 2 diabetes mellitus is same as senile cataract. Now, infant failure to thrive, pediatric question, mental retardations, hepatosplenomegaly, autism recessive condition, inherited congenital disease is nothing but galactosemia. A option is for complicated cataract, that is not correct. B is the correct answer. Oil droplet cataract is due to osmotic swelling of the center of the lens. Dots and flakes in the lenses can be seen in Christmas tree in myotonic dystrophy. In subcapsular, so many differentials, as the last question will be there. But here the answer is this is galactosemia, which will lead to oil droplet cataract. And the various differentials of PSC, I always say remember as BSC, B busulfan, B blowers cataract, that is glass blowers, S steroid, C complicated cataract, C chloroquine, and C cupuliform senile cataract. Chlorpromazine causes anterior subcapsular cataract. That's the 10 questions. I hope you have done well. Best wishes.